Good afternoon, friends. I am Dr. Pankaj Maheshwari. I am Senior Consultant and Chief of Urology at Fortis Hospital, Mulund. The topic of discussion today is to know about urinary stone disease. As you would be aware, urinary stone disease is an extremely common problem. With increasing urbanization, with improving diet, with improving lifestyle, the incidence of stone disease in India is on a rise. In our lifetime, the risk of us suffering from stone disease is at least 20%. That means 1 in 5 of us will have some stone problem in our lifetime. Not only this, as we know, stone is a recurrent problem. If I form a stone today, the chance of me forming a stone again in next 5 years is at least 80% if I don't take precautions. All put together, it is extremely important to understand what these stone issues are and how they form and probably how we can prevent them. We know that kidney plays a very important role of filtering out water soluble waste from our body. The water soluble waste are ammonia, urea, calcium, uric acid, phosphates. Whenever the levels of these rise in blood, it's the role of kidney to remove them from our blood in form of urine. Now the question will be, how do those stones form? To understand stone formation, we should look at one experiment which we had done as a child in school. If you are given 3 cups of water and if you are asked to dissolve say 1 teaspoonful in the first cup, 2 teaspoonful of sugar in the second cup and 3 teaspoonful in the third cup, you will realize that the sugar dissolves very easily in the first cup. It does not dissolve in the third cup. Now in the second cup, if I want the sugar to be dissolved, I have only 2 options. One, increase the fluid or reduce the amount of sugar. This is exactly what happens in our kidney. When the amount of water is less and the amount of crystals coming in are higher, these crystals would aggregate, gradually grow and present like a stone. So to prevent stone, we will need to break this cycle by either reducing these crystals or improving the liquids. We will come to prevention later on. We should also know how the stones present. Now, stones commonly would present by severe pain. It is said that kidney stone pain is one of the most severe pain a man will go through. Frankly, you are trying to deliver a stone, and obviously it is a pain which can be compared to the pain of a delivery. The pain will typically be in the flank. If I keep my hand just below my ribs, where my thumb is, the pain starts here and the pain goes towards where my fingers are. So a severe pain in this area associated with nausea, vomiting, associated with urinary difficulty, blood in urine, maybe fever, is a classical presentation of urinary stone disease. Some patients are absolutely unlucky that they keep on having and growing the stone without having any trouble. Why do I call them unlucky? Because these are the patients who present with giant stones. If they would have had pain in the right time, they would diagnose the stone when the stone is very small and the treatment would be easy. Just because you do not diagnose it in time, it keeps on growing and causing damage to the kidney. Are stones really pain-free? Yes, they can be pain-free in some situations, but more commonly it is our mistake that we miss the signs. If say tomorrow morning I get up with a pain in my back or flank, I would really not think of stone. What I would think of is maybe I didn't sleep well, I lifted some weight, or rather I try to give an excuse for this pain to some day-to-day activity and not really look at pain. So anytime you have unexplained pain or unexplained discomfort in your flank, back or urinary system, please go to your doctor and get yourself evaluated for urinary stone disease. Again, stones, if you diagnose them when they are smaller than 6 to 7 millimeters, will not need any surgery. They will come out on their own. The possibility of a 5 millimeter stone coming out on its own is at least 70%. Possibility of 4 millimeter stone coming out on its own is more than 85%. So if we diagnose stone as a small stone, then definitely it can come out by medicines. When the stone grows beyond 7-8 millimeters, most patients may need some form of intervention. Now, what are the common precautions that I can take to prevent stone disease? There are few common precautions that every stone patient should take. One, drink a lot of water. By lot, I mean liquids enough to produce 2.5 liters of urine. So I am not worried how much water you drink. What I would concentrate on is whether you produce 2.5 liters of urine. So based on your lifestyle, say if I am an office worker, predominantly sedentary lifestyle, to produce 2.5 liters of urine, I'll need probably 3.2 to 3.5 liters of liquid. I'm usually awake around 17-18 hours. So for 3.5 liters of liquid, I need approximately 200 ml liquid every hour in my waking hours. So a simple precaution of having 200 ml liquid every hour in your waking hours will help you produce 2.5 liters of urine, will help you reduce the risk of stone formation significantly. Now, how do I know I am really producing 2.5 liters of urine? There are a couple of things that you can watch for. On an average, in a single session of urination, we pass around 300 to 350 ml of urine. So if I have to produce 2.5 liters of urine, I should need to go to the restroom around 7 to 8 hours during 24 hours. So if I am going 7 to 8 hours during 24 hours, look at the color of urine. The color of urine should always be like water. So if I have a dilute urine and if I need to go to bathroom 7 to 8 hours, 7 to 8 times during 24 hours, then I am having adequate liquids. If not, you need to increase the amount of liquid. Further, if you are working in the field, you are a sportsman, or you are too much in exercise, or you sweat a lot, then your fluid intake will accordingly be higher. The second important precaution will be adequate exercise. Fast walking, jogging, skipping, jumping, the more you are physically active, the better it is for stone formation. How does exercise help? Small crystals tend to move, so they don't grow. Whatever calcium, uric acid, phosphate, that gets utilized by our bones and muscles, and less of that comes to the kidney. So by regular exercise, we help in both the ways. One, by helping evacuate small stones, and also the chance of stone formation reduces. And the last general precaution will be reduce salt in your diet. Avoid things which have excess salt. How does salt play a role? You know, salt is sodium chloride. Now in our kidney, the channel for calcium and sodium is same. So if I have a high sodium diet, the calcium channel will open and I will have a high calcium urine. If I have a low sodium diet, the channel for calcium will remain closed, so less calcium will go in the urine. So avoid things which have excess salt like papad, achar, chutney, chips. Occasionally having them is okay, but having them day to day in your diet will increase the chance of stone formation. If you realize these three precautions of water, exercise and salt restriction are not specific for a stone patient, every person should be doing this. Even if I don't have a stone, I should be doing exercise, I should be reducing salt, I should be having adequate liquids. So just trying to maintain your overall health will reduce the chance of stone formation. So friends, take care of your health, be lean and trim, exercise regularly, reduce your salt, control your blood pressure, diabetes well, so that your kidney function remains well and the chance of stone formation reduces. Thank you and best wishes.